Good day, everyone, and welcome to Group 6's presentation on non-Hodgkin's lymphoma. This presentation was done by Chelsea Toby, Tricia Ramkissoon, Tityana Sorzano, Keia Walters, and Britney Solomon. Now that we've introduced the topic, let's start by learning what lymphoma actually is. My name is Britney, and I'm going to talk to you about what lymphoma actually is. Lymphoma is a treatable cancer that starts in the body's infection-fighting cells called lymphocytes. Around the world, more than 864,000 people are diagnosed every year, and it is one of the most common cancers in children and young adults. The treatment and outlook depend on the type and stage of the illness. It's important to understand the difference between Hodgkin and non-Hodgkin's lymphoma. However, in this case, we'll be concentrating on non-Hodgkin lymphoma. Non-Hodgkin's lymphoma is a cancer that develops in the lymphatic system of your body, which is responsible for fighting diseases. It causes cells to grow abnormally and form tumors from the small white blood cells of the body. There are several types of non-Hodgkin's lymphoma based on which cells they originate in and how quickly they spread. We have B-cell lymphoma. This one starts in the B cells, which are responsible for producing antibodies to fight infection. This is the most common form of non-Hodgkin's lymphoma. And we also have T-cell lymphoma. This one starts in T cells, and these are responsible for killing foreign bodies. We have a diagram for clearer understanding. In this diagram, it compares the two types of lymphomas, non-Hodgkin lymphoma and Hodgkin lymphoma. As we can see, the key difference is that in Hodgkin's lymphoma, we have a specific cell called Reed-Sternberg cells, while non-Hodgkin's doesn't. Additionally, non-Hodgkin lymphoma develops from two types of immune cells, which we discussed previously, the B cells and the T cells, and these can form tissues. Now we're going to look at the causes of non-Hodgkin's lymphoma. There is no clear consensus on what causes this cancer. It develops when your lymphocytes, instead of dying and being replaced by new ones, continues to grow and divide into more lymphocytes. It is also more common than Hodgkin's lymphoma. The following factors have been linked with the development of non-Hodgkin's lymphoma, though some of these are still under study. There's increasing age, there's males are more liable to develop the disease, immune system deficiency, interaction with chemicals such as pesticides or insecticides, or if you've had an organ transplant. There are four symptoms associated with non-Hodgkin's lymphoma. We have the local symptoms and the systemic symptoms. In the local symptoms, there's swollen glands or your lymph nodes, and these are often found in the neck, armpit, or groin that are painless. And we also have cough. Now, for the systemic symptoms, there's night sweats and fever, among the many others.
Hi, I am Keia Walters, and today we are going to look at the pharmacological interventions for non-Hodgkin's lymphoma. Intervention strategies. 1. Pharmacological interventions for non-Hodgkin's lymphoma. Pharmacological treatment of non-Hodgkin's lymphoma can be done through chemotherapy. Chemotherapy is a treatment that is administered intravenously or orally and targets rapidly dividing cells and cancer cells from growing and spreading. It can be effective in shrinking tumors and killing cancer cells, preventing the spread of cancer. Chemo is usually given in cycles, which involves a period of treatment followed by rest. This is done to give the body time to recover. Key chemotherapy drugs for non-Hodgkin's lymphoma. Chemotherapy remains a cornerstone in treating non-Hodgkin's lymphoma. Here are some of the primary drugs and how they work to combat the disease. First, we have the alkylating agents. This does damage to the DNA to stop the cancer cells from reproducing. Then we have the core corticosteroids group of medications, and these drugs help to reduce nausea and vomiting from chemo. Then we have the antimetabolites, and these drugs blocks DNA or RNA production, preventing cell growth. Then we have the anthracyclines, and these are anti-tumor antibiotics that disrupt DNA copying in cancer cells. Side effects of chemotherapy. As we've seen, chemotherapy plays a vital role in managing non-Hodgkin's lymphoma. However, it is important to consider the impact these treatments can have on the body. Chemo drugs can cause side effects, and this is dependent on the dose given, the type of drugs given, and the length of the treatment. These symptoms usually go away after treatment has ended. Common side effects are nausea and vomiting, hair loss, mouth sores, easy bruising and bleeding due to fewer blood platelets, fatigue due to fewer red blood cells, and an increased chance of infection from having fewer white blood cells. Some chemotherapy drugs can cause late or long term side effects, which can occur long after the treatment has ended, such as heart and lung damage. And in children, it can damage fertility and the body's growth.
Hi, my name is Chelsea Toby, and I will be presenting on the second intervention strategy, which is alternative medicinal treatments for non-Hodgkin's lymphoma. You may learn about alternative or complementary approaches for relieving symptoms or treating cancer that your doctors have not suggested. These approaches can include vitamins, herbs, and specific diets, as well as acupuncture and massage, just to name a few. Complementary approaches are treatments that are utilized in conjunction with your usual medical care. Alternative treatments are utilized in place of regular medical care. Now, let's take a closer look at some of these alternative and complementary treatments. We'll explore how they work, their potential benefits, and their role in supporting individuals undergoing cancer treatment.
Hi, I'm Tricia ramkissoon, and I'll be discussing complementary methods. Nutritional support. A balanced diet that is rich in fruits, vegetables, and greens can support overall health during treatment. Mind therapies. Meditation and yoga can help to reduce anxiety and improve physical well being. Exercise and physical activity helps to maintain physical strength and reduce fatigue during the treatment period.
Hi, my name is Tityana, and I will be discussing emerging and experimental treatments. Some immunotherapy and imaging treatments are CAR-T therapy, which is a promising option for certain types of NHL, especially when other treatments like chemotherapy or radiation have failed. Additionally, checkpoint inhibitors boost the immune system's response to cancer cells. Dual CAR-T therapy targets multiple antigens on lymphoma cells for enhanced treatment effectiveness, and clinical trials which offer access to cutting-edge therapies, including new targeted treatments or combination approaches.
In conclusion, non-Hodgkin's lymphoma is a complex and diverse group of blood cancers that affects thousands of lives worldwide. By understanding what it is, recognizing its causes and symptoms, and being informed about the available treatments, we take a significant step toward early detection and effective management. Advances in medical research continue to bring hope, offering improved outcomes and quality of life for patients. Together, through awareness and continued support for research, we can play a part in combating this disease and supporting those affected by it.